Hi, I'm Dr. Blake Vidrine with Louisiana Implants and Dentures. Today I want to talk to you about full mouth restorations. There are a lot of options and sometimes it can get a little bit confusing. So in this video, I'll go over some treatment choices, how to figure out what options might be right for you, and give you an idea on pricing as well. Let's get started. I'm going to break it down into three separate sections: dentures, snap-in dentures, and all-on-4s. So what is all-on-4? Well, it goes by a few different names: all-on-4, all-on-X, all-on-6, hybrid restorations, full mouth implant bridge. Those all are basically referring to the same thing. It's a set of implants on the top or on the bottom or both. They're meant to replace a full set of missing teeth by putting implants in that teeth are attached to permanently so they don't move around. You can eat whatever you want, smile, talk, laugh. They're not gonna move around, they're not gonna fall out. You're not gonna be embarrassed at dinner because you can't chew or anything like that. They stay in place and you can eat whatever you want. One thing that we really strive for with them is having a really natural look. We'll take pictures, we take scans, we get all the information before we even do the surgery so that we can pick teeth that match your face and look like they're supposed to fit to you. We have different color options, we can customize teeth, we can make them smaller, we can make them bigger. It's not a standard set of teeth that we use for everybody. It's specific to every case. So who's a candidate for all-on-4? Anyone with missing teeth, broken teeth, a lot of teeth pain, periodontal disease, maybe if you're wearing partial dentures or full dentures, it can be a much better option than dentures. It stays in place. You don't have to take it out at night. It's not gonna come out when you're chewing on food. It's really, really strong. It's made out of a much stronger material than dentures. Dentures are an acrylic material. All-on-4 is made out of zirconia. It's like a really strong glass material, so it looks really nice and it's almost unbreakable. You can eat anything you want. You can eat peanuts, almonds, hard foods like that, and you're not gonna break it. It's a really great option, especially if you're coming from dentures or partial dentures or something like that. One of the great things about all-on-4 is that it's really customizable. Different shapes, different sizes, different colors of teeth. I got a couple different examples here that do a really great job of illustrating the customization for different patients. Different shapes, different colors, different sizes. They're made to fit that individual person. We've got every color from really white. Some people want a really nice white smile, and some people want a more natural look. One question that I get all the time is, how do you take care of it? Well, it's really, really easy. First, you have to brush it like normal, just like you would your natural teeth. Second, that's really important, is to use a Waterpik. So part of the teeth, the bottom side pushes up against your gums, and to clean that junction between your teeth and your natural gums, you use a Waterpik, which is basically just a little water jet that shoots water in that area and can clean anything out. It works really well. They're really cost effective, and it really is essential for implants and taking care of them. So one thing I want to talk about is the difference between dentures and all-on-4. It's a really big difference in fit, in functionality, and in looks. So one of the main issues with dentures is that there's really nothing to hold them in. It relies on suction, it covers the roof of your mouth, it can be uncomfortable, it always feels like a mouthful, and it can be hard to taste your food since the roof of your mouth is covered. So one of the big benefits of all-on-4 is that it doesn't cover the roof of your mouth. And it also attaches to those implants so it doesn't come in and out. It doesn't feel like a mouthful, it just sits on top of your gums in the same area that your teeth were sitting in. So it's a much more comfortable option and a lot more functional too. So a lot of patients ask, can I get my teeth right away? Yes, you can. We can deliver teeth the same day, but we usually wait until the next day. It gives us time to make the teeth, make sure everything's right, so we get a really good result. You really want to avoid trying to get final teeth too fast because a lot of things happen and a lot of things change while those implants are healing. Your gums will shrink, they might change, and you might not like the teeth that much at first. Sometimes it might take a couple of trials of temporaries to get teeth that really fit you, that you really like. We'll do however many it takes to make sure that you get a result that you love. So let's talk about the healing phase for implants. It typically takes about 3 months for your bone to fuse to the implants and be fully healed. During that time, you want to be careful with them. You don't want to eat anything too hard, but you don't have to be on a liquid diet either. It's okay to work the implants a little bit and chew some normal foods. Softer foods, but still real food, so you don't have to feel like you have to blend everything up or anything like that. Another part of the healing phase has to do with customization. Doing a temporary teeth instead of final teeth makes it easier to make adjustments and make changes before we finalize everything for your final teeth. Those zirconia teeth are really hard and they're almost impossible to change, so you want to work out all those little details before you get to that stage. You might see a lot of marketing around getting final teeth really quickly, maybe in 24 hours, maybe in a week, but that's something you really do want to avoid so that you can make sure that all the kinks are worked out before you get to that stage and that you're fully healed and stable. One thing that you really want to be sure of with All-on-4 is what final material that you're going to be getting for your teeth. Zirconia is far and away the best material. It looks the nicest, it lasts the longest, it's the strongest, it's not going to break, but not everybody will use that material. Sometimes some people will use acrylic material, which is cheaper, but it doesn't work as good. It's harder to eat with, things break more often, it flexes more than zirconia, and it's not as good for the implants. It can be harder to keep clean too, and it stains. That's one of the great things about zirconia. It doesn't stain. Even 10 years later, it looks basically like the day you got it. So as an example, I have a set of temporary teeth here and a set of zirconia teeth here. And the temporaries are great for their adjustability, but they're not meant for long term. So one thing we do offer if you're looking for a more affordable option is what we call a long-term temporary. It's just like the temporary that I just broke, but it has a titanium bar inside of it, so it's not going to break. It's not meant to be used forever, but it's a really good option that can buy you a few years, 3 years, 4 years, 5 years, maybe until you can finally pay for those zirconias. So it puts you in teeth that are really strong that you can use for a few years, but eventually they'll wear down, they'll stain a little bit, and you'll want a replacement. And at that time, you'll want to go to those zirconia teeth, which are easier to clean, they don't stain, and they're just a better product overall that's going to last a lot longer. What if you've been told that you don't have enough bone for implants? It's really rare that someone comes to our office and doesn't have enough bone for implants. We do these cases all the time, and there's always bone somewhere for patients to get the teeth that they need. It's very experience-based. If you do a lot of cases, it's easier to work with less bone, and it's just a comfort level thing. Some providers aren't as comfortable with cases with less bone, and some other ones are if they've done more of those cases. If you've been told you don't have enough bone, I want to highly encourage you to get a second opinion, because that may not be the case for every provider that sees you. Bone grafting may be an option, or maybe there are other techniques, such as maybe pterygoid implants, that might be an option for you. I've seen people come in who've been quoted over $60,000 for a full mouth of implants, and we offer prices that are significantly lower than that. One thing that's really important to us is being transparent with our patients. We put pricing right on our website so you can see some pricing before you even come in. We also offer package pricing, so we give you a case price, which is usually the price on our website, and it covers everything. Extractions, implants, it doesn't matter if it's 4 implants or 6 implants, it's whatever your case needs to make sure that you get the best result possible. One of the ways that we make our teeth more affordable here is that we have an in-house lab. It helps us do it for cheaper, and it also gives us more control over the process to make sure that all the details are done right and it's more affordable for you. A really common question I get is, will I be asleep? So we always give our patients some sort of sedation for every case. 90% of our patients do a pill that relaxes you. You're still awake and aware. I can tell you to turn your head left or right, open your mouth more, but you're really comfortable the whole time. Your mouth's fully numb, and most people are just falling asleep most of the time. That option works well for almost everyone, but we do also offer general anesthesia. We bring in a CRNA, and we can put our patients fully asleep for those patients that are more anxious. It's a little bit more expensive, but it's worth it for the people that really need it. So next up, we have snap-in dentures. They're also known as overdentures. They snap onto implants, but they also come off. You can take them on and off. You take them off at night, just like a regular denture. They're basically a regular denture, but with a piece that snaps into the implant. They're a big improvement over a lower denture, but they're not comparable to All-on-4 in functionality. They still cover a lot more of your gums. They're a little bit more bulky, but a much better option than a lower denture. We also don't do snap-in dentures on top for a couple of different reasons. Number one, your bone quality is generally not as good on the top, and the in and out action of snapping the teeth in can cause issues to the implants over time. Number two, they're also really expensive to do on the top because they require more implants generally, and also some extra parts in the denture to make sure that it doesn't break. Let's briefly compare bite force of a denture, a snap-in denture, and All-on-4. So when I say bite force, what I'm really talking about is how much food you can eat. You can bite just as hard with a denture or a snap-in or All-on-4, but it's the stability of them that makes a difference that helps you actually eat the food. So with dentures, you're only going to restore 10%, maybe 25% max of your chewing ability. Snap-in denture on the bottom paired with a denture on the top, you can get up to 30, 40%, maybe 50% of foods that you used to be able to eat. The reason is they still come in and out, they're still made of acrylic, they're not perfect. That snap-in is an improvement over a lower denture, but it's not perfect, it's not permanent, it's not perfectly stable. But All-on-4, the way that it's attached to the implants, nothing's moving around, so you can actually use all of that bite strength that you have to stably eat things, and things aren't going to move around and give you trouble when you're trying to chew on food. Is it possible to start with a lower snap-in denture and move to All-on-4 later? Sometimes. The implant positions are important for All-on-4 and they're important for snap-ins, but they can be slightly different sometimes. If you have abundant bone, then there's a good chance that you could convert it later on. If you have less bone, that may not be the case. Implants may have to be removed, maybe the surgery might have to be done. It's a very case-specific thing and patient-specific thing. So it's a really good question to ask on the front end, but it's always best to start with All-on-4 if you can. What about cost of snap-in dentures? The costs on these can vary a lot because, for example, extractions aren't included in the price. So if you have one tooth, it'll be a lot cheaper than if you have 25 teeth to pull. So that can make a big difference. Also, you can have 2, 3, or 4 implants for a snap-in denture. It doesn't have to be 4. 2 helps a lot better than a lower denture, but 4 implants is a lot better than 2 for stability of your snap-in denture. What about our traditional dentures? Our final option for full mouth restorations. They are an okay replacement for teeth. They come in and out. The top one covers the roof of your mouth. The bottom sits on your lower jawbone. You have your tongue moving around with the bottom one. The bottom one tends to give people a lot more issues because it just doesn't really have much to hold it in, and it's fighting with your tongue every time you talk, every time you try to eat. There's just not a whole lot in place to hold dentures where they need to be. So they tend to be a lot more difficult to use, harder to get used to. They're good for smiling and talking. They're not great for chewing. They'll only restore 10 to 20% of your chewing ability, and they leave a lot of things to be desired with them. The main benefit of dentures is cost. They're the most affordable option of the full mouth restoration options, but they come with the most deficiencies. They're harder to use, but they're a little bit cheaper. Price range, you're usually looking at $2,000 to $4,000 per arch, depends how many teeth you have. There might be different denture options, a premium option or a lesser option, so it can range quite a bit. The main factor in cost is usually how many teeth have to be pulled. As far as how dentures compare to All-on-4, there really is no comparison. One stays in place and you can eat whatever you want. It's not gonna move around. It's gonna look better. It's gonna feel better. You'll be able to taste your food better. And the other is just a big drop off from that and is more difficult to use in pretty much every way. So that's what you need to know about your full mouth implants, snap-in denture options, and your denture options. If you found this video helpful, give us a thumbs up and subscribe. If you have any questions, leave them in the comments and we'll be happy to answer them for you. I'm Dr. Blake Vidrine with Louisiana Implants and Dentures, and we'll see you next time.